Hello everyone, welcome back to Pharmacology Made Simple for Nursing Students. In the previous class, we have seen regarding the parenteral routes, especially the injections forms, that is the intradermal, then intravenous, subcutaneous, and various other forms of injections. In today's class, we will be seeing about the remaining routes of drug administration. Let's move on. Inhalation. Volatile liquids and gases are given by inhalation. Example, general anesthetics. Solutions of drugs can be atomized and the fine droplets are inhalation as aerosol. Example, salbutamol. These inhaled drugs and vapors may act on the pulmonary epithelium and mucous membranes, respiratory tract, and are also absorbed through these membranes. So, how is it absorbed? It is absorbed through the respiratory membranes. So, inhalation can be given in various forms. Here we can see the image of a patient who is taking it as a spray form for asthma, or it could be given in the nebulization form where the solution is put into a machine and the aerosols are released from the machine which goes in from the pipe to the mask, and there the person is inhaling the drugs. What are the advantages of inhalation route? Almost instantaneous absorption of the drug is achieved because of the large surface area of the lungs. In pulmonary diseases, it serves almost as a local route as the drug is delivered at the desired site, making it more effective and less harmful. The hepatic phosphorus metabolism is avoided, and the blood levels of volatile anesthetics can be conveniently controlled as their absorption and excretion through the lungs are governed by the law of gases. So, here the main advantage is the drug action will be immediate because of the large surface area of the lungs. What are the disadvantages of inhalation route? The advantage is that it can cause the increase in the pulmonary secretions. Okay, and such gases should be avoided. Even when you take smoking, see, nicotine is also a drug which is present in the cigarette. So when you're smoking, what happens? It will increase the phlegm production and therefore cause the pulmonary edema, chronic bronchitis, and bronchiectasis. And even some exposure to the irritant gases is from air pollution, from factories, and all that will increase the phlegm production and lead to the pulmonary diseases. Transdermal. Highly lipid soluble drugs can be applied over the skin for slow and prolonged absorption. Example, nitroglycerin ointment in case of angina pectoris. What is angina pectoris? Angina pectoris means chest pain. Okay. So, what are the various forms of transdermal drug delivery? They are adhesive units, induction, ionotrophorus, and jet injections. The adhesive units, these are patches of different sizes and shapes, and they are made in such a way that they suit the area of application. The drug is held in a reservoir between an outer layer and a porous membrane. The drug slowly diffuses through the membrane and percutaneous absorption takes place. The rate of absorption is constant and predictable. The sites of application are mostly the chest, abdomen, upper arm, back, mastoid region, and scrotum. The example of drugs are hycosine, nitroglycerin, testosterone, estrogen, and phenytoin. So here you see the image of the transdermal patch So where is the drug? The drug is in the reservoir, and it is applied to an area of the skin, and slowly the drug is released from the porous membrane of the patch, and through percutaneous absorption it is absorbed into the skin. Induction. The route where the drug is rubbed on the skin gets absorbed to produce systemic effects is called induction. Okay. So slowly through the skin, it gets absorbed into the systemic circulation. That method is known as induction. Inotrophoresis. In this procedure, galvanic current is used for bringing about penetration of lipid insoluble drugs into the deeper tissues where its action is required. Example, salicylates. Fluoride ionotrophosis is used in the treatment of dental hypersensitivity. Here you can see the diagram of the ionotrophosis device. See, the drug is placed on the skin, and on top of the drug an electrode is placed, and we are giving the galvanic current. So what the galvanic current is doing, it is helping the drug to get released into the deeper areas of the tissues. So it will go through the skin into the blood circulation, and it will be easily absorbed. This is especially used in case of lipid insoluble drugs which has to go into the deeper tissues. The next method is jet injection. An absorption of the drug occurs across the layers of the skin. Dermojet may also be considered as a form of transdermal drug administration. Here you can see the image of the jet injection delivery. Here what is happening is there is no syringe. Okay, so because of the increased high velocity, the drug is getting injected into the layers of the skin. The next route is transmucosal route. Transmucosal administration includes the sublingual, nasal, and rectal routes. Sublingual, here the tablet or pellet is placed under the tongue. As the drug dissolves, it is absorbed across the sublingual mucosa. The formulation should be lipid soluble, example, nifedipine. In the image, you can see how the tablet is placed under the tongue, and it will be absorbed through the sublingual mucosa. Nasal. Drugs can be administered through the nasal route either for systemic absorption or for local effects. Example, for systemic absorption is oxytocin spray, and for local effect like decongestant, nasal drops can be used. The other examples are budesonide nasal spray for allergic rhinitis. Next, in rectal, rectum has a rich blood supply, and drugs can cross the rectal mucosa to be absorbed for systemic effects. Drugs like indomethacin, chloropromazine, diazepam, and paraldehyde can be given rectally. Drugs may also be given as rectal enema. Enema is the administration of drug in liquid form into the rectum. Here in the image, we can see the type of enema which is being administered is a barium enema, where it is prepared beforehand. The enema tube has to be lubricated and inserted into the rectal area, and then you have to keep the solution at a height so that through the gravity flow it will flow into the rectum, and once it fills up the colon, after 15 to 20 minutes, x-rays are taken, and later the barium solution is drained out through the tube. This is an example of retention enema. Next, we move on to topical routes. The drugs may be applied on the skin for local action as ointment, cream, gel, powder, or in paste form. The drugs may also be applied on the mucous membrane, as in the eyes, ears, and nose. Finally, we'll see about the special drug delivery systems. One of the special drug delivery systems is OcuSert. OcuSert systems are thin elliptical units that contain the drug in a reservoir, which slowly releases the drug through a membrane by diffusion at a steady rate. One of the examples is pilocarpine OcuSert used in glaucoma. Here we can see an image of the pilocarpine opposite, which is inserted in the eye, and the pilocarpine drug is within the reservoir, and there is an outer covering through which uh, the drug can be attached into the eye. The next form is prodrug. Prodrug is an inactive form of a drug which gets metabolized into the active derivative in the body. So, to overcome some disadvantages, drugs are given in the form of prodrug. For example, one of the drugs is dopamine. Unless the dopamine is actually an active drug, it will be given as a prodrug in the form of levodopa, and this will come into action only after it crosses the blood-brain barrier. Or sometimes the drugs, once it goes into the liver, after it gets metabolized, then only the action of the drug is released. So that is the difference between a prodrug and an active drug. The next method is osmotic pumps. Osmotic pumps are small tablet-shaped units containing the drug and an osmotic substance in two different chambers. The tablet is coated with a semi-permeable membrane in which a minute laser drilled hole is made. When the tablet is swallowed and reaches the gut, water enters into the tablet through the semi-permeable membrane. The osmotic layer swells and pushes the drug slowly out of the laser drilled orifice. This allows slow and constant delivery of the drug over a long period of time. Okay, so here we can see the image of osmotic pumps. So there is a semi-permeable membrane, there is an osmotic layer and an agent, and the flow of the drug can be moderated with the flow moderator, and then it can be swallowed, and slowly this drug will get released when it reaches the gut. The other method is computerized miniature pumps. These are programmed to release drugs at a definite rate, either continuously as in case of insulin, or intermittently in pulses as in case of gonadotrophin hormones. So here we can see the image of a insulin pump controller, where into the skin a cannula with a tubing is placed, and the medicine also, it is the medicine is in the form of the computerized miniature pump, where we can control how many units of drug has to go into the body per hour, or say 4 hours once, 3 hours once, how many units of the drug has to enter into the body. The next method is monoclonal antibodies. The monoclonal antibodies is used especially against the tumor-specific antigens and are used to deliver anti-cancer drugs to specific tumor cells. Here in the image, we can see how exactly this monoclonal antibody acts. Say there is a cancer cell, and this cancer cell will have an antigen, that is a protein on the cell that can cause the immune system to respond. So when the monoclonal antibody locks itself into the antigen, it causes the immune system to attack the cancer cell. So the monoclonal antibodies will help in the destruction of the cancer cells. The next method is liposomes. Liposomes are phospholipids suspended in aqueous vehicles to form minute vesicles. Drugs encapsulated in liposomes are taken up mainly by the reticuloendothelial cells of the liver and are also concentrated in malignant tumors. So here also, this is also similar to the monoclonal antibody types where there is a hydrophobic anchor. This will go attached to the specific tumors, and once it gets attached, then the drug will be released and the cancer cells can be destroyed. These are the various special types of drug delivery systems. It is important to know because we have to always update ourselves with the latest technologies. The important questions that can be asked from this topic is transdermal patch for 5 marks, transmucosal route of drug administration for 5 marks, antrophorosis for 2 marks, enema for 2 marks, and prodrug for 2 marks. Please subscribe, like, share, and comment so that we can improve